What if I told you that your joint pain isn't just about how old you are, your genetics, or even how hard you exercise, but rather it is about how you are standing right this very second? Today, I am going to show you how your daily posture and full body engagement may be quietly protecting or secretly stressing your joints every single hour of the day. We are talking about no gym memberships, no expensive equipment, just pure awareness and alignment. Arthritis. It is a word that carries a lot of weight. It affects millions of people all over the world, bringing with it the heavy baggage of pain, stiffness, and a frustrating reduction in mobility. When we talk about arthritis prevention or managing flare-ups, the conversation almost always turns to the same three things: anti-inflammatory diets, expensive supplements, or low-impact workouts. And while those things are incredibly important, they are missing a massive piece of the puzzle. Think about this. You might spend 1 hour in the gym, but you spend the other 15 hours of your waking day sitting, standing, and moving under the influence of gravity. Your daily posture represents thousands upon thousands of joint-loading repetitions. If you are misaligned and not engaged properly, you are essentially doing thousands of bad reps, grinding down your gears without even realizing it. So we are going to reframe the problem. We are going on a journey to explore what is actually happening inside your joints, what the science actually says without the hype, and finally, a practical, holistic posture and engagement routine you can use immediately. I want you to see yourself not just as a patient or a person with pain, but as the architect of your own body's alignment. To understand why standing tall matters, we have to visualize the invisible machinery inside of you. Let's strip away the skin and muscle and look at the joint itself. You have cartilage, which acts as bushings or cushioning. You have synovial fluid, which is the thick, nutrient-rich oil that lubricates the movement. You have the subchondral bone underneath, which handles the load transfer, and you have the ligaments and fascia that provide stability. Here is the core concept that most people miss. Your joints are designed to handle a specific load, but they rely entirely on proper and full engagement of muscles with balanced movement and precise alignment to stay healthy. And imagine a car. If your tires are perfectly aligned, they wear down evenly over years and years. But if the alignment is off by just a fraction of an inch, one side of the tire goes bald while the other looks brand new. This is exactly what happens in your knees and hips. Poor alignment creates uneven load distribution. Some areas of your cartilage become drastically overstressed, taking 10 times the pressure they were designed for, while other areas are underused and begin to atrophy. This uneven loading leads to long-term consequences. It starts as minor irritation, which triggers chemical pain signals. Over time, that irritation creates wear patterns that increase your degeneration risk. But here is the good news. This is where posture enters the picture to change the trajectory. Now, I want to be incredibly clear and responsible here. Posture alone does not cause arthritis. It is a complex issue. However, when we look at joint pain relief and long-term health, the research paints a fascinating picture. Science shows us three major insights. First, researchers have found distinct differences in posture among those with osteoarthritis. Specifically, people with knee issues often display changes in pelvic tilt, ankle stiffness, and an increase in postural sway. The body is trying to compensate for instability. Second, we see changes in gait and foot angles. Studies indicate that even small alignment tweaks, properly engaging the muscle of the foot, altering the angle of the foot by just a few degrees, can significantly reduce the load bearing down on the knee compartment. Third, and perhaps most importantly, is the connection between posture and proprioception. Proprioception is your body's ability to sense where it is in space. In conditions like osteoarthritis and rheumatoid arthritis, this body awareness is often impaired. The research takeaway is clear. Alignment, fully engaged muscles, and movement patterns directly influence how much load and irritation your joints endure. Science doesn't say posture is everything, but it clearly says it matters. So let's move from theory to practice. We are going to build your joint-friendly posture routine. This is not an exercise program. It is a way of being in your body. We start with the daily micro check. This is a 30-second reset you can do anywhere. I want you to stand up if you can. First, look at your feet. See what kind of alignment your feet are in. Are your toes pointing forward? Engage your feet like they are talons of a bird reaching out to hold. Keep them grounded with your weight distributed evenly between the heel and the ball of the foot. With your feet fully engaged, bend your knees slowly. They should be soft and feel well supported. Keep everything engaged right down to the tip of the toes. Now check your pelvis. We want neutral, not tucked under, not sticking out. Imagine your pelvis is a bucket of water and you don't want to spill a drop forward or backward. Move up to the chest. Open it up. Relax the shoulders back and down, away from your ears. Finally, stack your head over your spine. From the inside, feel the crown of your head lifting toward the sky, lengthening your neck. Engage your body gently. Feel a sense of lengthening from your fingertips to your toes. This awareness alone starts changing the load on your joints by using more of the muscles. But we don't just stand still, we move. This is movement integration. When you stand up from a chair, do you flop forward or do you drive through using your feet? When you bend to pick something up, do you round your spine or do you hinge at the hips? The key idea here is full body engagement. We want your muscles to take the force, not your joints and bones. We must also consider the holistic layer, include body work and energy resets. It's delicate but essential to alignment. Consider reflexology or foot massage. Tight feet prevent ankle movement, which twists the knees. Foot flexibility and muscle engagement protects joints. Relaxing hip and glute muscles with acupressure or aromatherapy helps the joint sit properly. Also, follow the anti-stagnation rule. No negotiation on movement variation. The oil in your joints, synovial fluid, does not pump like the heart. Only when you move. Joints starve after 4 hours of sitting. You must stand, twist your torso, walk briefly, or do a leg swing every 30-60 minutes. Last, we add healthful practices. Weight management, anti-inflammatory diets, and sleep for tissue healing are crucial. Functionally, train feet, glutes, core, and ankles. These protect your joints. Why are postural habits so important now, especially if you're not in pain? We must rethink joints, not ordinary door hinges. They are fluid, dynamic systems that adjust to your signals. The kinetic chain must be understood. Body loops continuously. The feet affect the ankles, which affect the knees, which affect the hips, which affect the spine. One typical misalignment is overpronated feet, where the arches collapse inward. This rotates the shin bone internally. Rotation grinds knees. The pelvis tilts forward, compressing the lower back while the femur rotates to meet. A domino effect. Locking your knees while in line at the grocery store bypasses your muscles and stresses your ligaments. Tissues adapt maladaptively to stress over time. They stiffen and thicken, making them more susceptible to injury. The inspiring message is that arthritis prevention isn't luck. Joint resilience comes from early postural awareness. You're not waiting for degradation, building a structure that resists it. As we come to a close, I ask that you reflect on your body. What portions of the body become more rigid in the morning? Do you observe asymmetry, such as one shoe wearing out more quickly than the other? Could it be that one side of your body is more active than the other? Pills and surgical procedures are not always effective in resolving issues. Sometimes the most effective treatment is the one that you perform on a daily basis. Engagement patterns. Here's a 14-day challenge. Engage your full body and maintain proper posture for a period of 14 days. Every day, throughout the day, perform a micro check at least 3 times. Arrange the feet and stack back, the spine. Each day, make it a habit to engage and elongate your entire body for 2 minutes, focusing on your breathing, and see how your muscles support your skeleton, and then carry that engagement throughout the day. Make a note of how your joints are feeling. Leave a comment below if you're interested. Keep your structure in your grasp. Tell us about the changes that occur in your body while you concentrate on foundation. Remember that although posture may not be the root cause of all of your issues, it can be a major factor in finding solutions to those issues. I would like to assist you in developing a system that is aligning you properly for years to come. Subscribe to receive additional information and wellness recommendations related to holistic health wellness. To support your joints, stand like a mountain, engage your muscles, and flow like water. Here's to the next video.